Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Night Sweats and Heart Problems, When to Be Concerned, and trust me, it's juicier than your cousin's peach cobbler. Are your night sweats trying to tell you something about your heart? Most people ignore this warning sign until it's too late. Today we'll reveal when night sweats signal serious heart trouble. You know, folks come into my office all the time complaining about waking up soaked like they just ran a marathon in their sleep, and 9 times out of 10, they're brushing it off like it's no big deal. But here's the thing, your heart and your night sweats are having a conversation you need to listen to. Let me break down the heart-night sweat connection for you. When your heart starts struggling with failure, fluid builds up in your system like a backed-up sink. Your body's trying to get rid of that excess fluid, and guess what? You're sweating it out at night. It's like your body's emergency drainage system kicking into overdrive. Then we've got coronary artery disease. Those arteries are more clogged than a fast food drive-thru on Sunday. Your heart's not getting the oxygen it needs, so it's working harder than a one-legged cat in a sandbox. All that extra work generates heat, and boom, you're waking up drenched. And don't get me started on arrhythmias. When your heart's beating like a jazz drummer having a seizure, your circulation goes haywire. Your body's temperature regulation system throws up its hands and says, "I quit." The result? You guessed it, night sweats. Now, there are some red flag symptoms that should have you speed dialing your cardiologist faster than you can say emergency room. If you're having night sweats plus chest pain or pressure, that's your heart sending up a flare signal. We're not talking about a gentle reminder here. This is a full-blown SOS. Sweating with shortness of breath during normal activities. Maybe you're getting winded walking to the mailbox and breaking out in a sweat. That's not normal. And maybe I should see you in the clinic. We need to talk. Cold sweats combined with nausea or dizziness are particularly nasty. It's like your body's throwing a 3-alarm tantrum, and sudden onset of severe night sweats without any other illness. That's your heart potentially crying for help. But here's where it gets tricky. Not all night sweats are heart-related. I've got to be honest with you because I can't make this stuff up. Menopause can turn women into human sprinkler systems. Certain medications can make you sweat like you're in a sauna. Infections will have you changing sheets like you're running a hotel. Room temperature and heavy blankets are common culprits too. If you're sleeping under a comforter that weighs more than your pet, you might just be overheating the old-fashioned way. Here's the key difference. Heart-related sweats feel cold and clammy, not just warm. It's the difference between stepping into a cool, damp basement versus walking into a warm kitchen. Heart sweats happen even in cool rooms with light bedding. Your body's thermostat is broken, not overwhelmed. Let me tell you about Sarah. She's 52 and ignored her night sweats for months, blaming menopause. Smart woman, successful career. But when it came to her heart, she was playing ostrich. When she started adding shortness of breath to the mix, she finally dragged herself to see her doctor. Tests revealed a 70% blocked coronary artery. Yep, entirely true. That early treatment prevented what could have been a major heart attack. Sarah's now doing great, but she'll tell you herself she wishes she hadn't waited so long. So here's your actionable takeaway, and I want you to actually do this. Track your night sweats for 1 week. Note the frequency, what they feel like, and any other symptoms. Are you waking up cold and clammy or just warm? Are you short of breath? Any chest discomfort? And listen carefully. If your sweats come with chest pain or breathing problems, see your doctor immediately. Don't wait, don't Google it, don't ask your neighbor. Get professional help. Your heart's been beating for you every single day of your life without asking for a vacation. The least you can do is pay attention when it's trying to tell you something important. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.